Hi, I'm Nil Albiol. I'm a hematologist at Hospital de la Santa Creu in Sant Pau in Barcelona. Today, I've been asked whether mRNA-based COVID vaccines lead to adverse events in recently transplanted patients. In the beginning, when these vaccines became available, safety data in hematopoietic stem cell transplant recipients was unknown due to the exclusion of these patients from trials. Some concerns were raised by the fact that transplant recipients' immunity is so distorted that vaccines might lead to serious immune-mediated complications, such as autoimmune cytopenias or graft versus host disease flares, especially if vaccines were given during the early post-transplant period. In this line, in a paper published last year in the Transplantation and Cellular Therapy Journal, the authors described up to 10% of new onset or worsening cytopenias following vaccine administration, as well as around 10% of GVHD flares. However, establishing a causal effect is quite difficult, and when you are analyzing transplanted patients, GVHD or unexplained cytopenias are quite common. On the contrary, in our center, we prospectively examine a very homogeneous cohort of recently transplanted patients, whose transplant date was between 3 months and 2 years ago, and did not observe any of these complications. Two recently published studies, one from Japan and another one from Israel, also didn't find any side effect of this kind among these patients. So our results have been reported in abstract form in the recent EBMT 2022 annual meeting. And what did we observe? Well, in the original phase 3 trial, published in the New England Journal of Medicine, which did not include transplanted patients, the authors described around 85–88% of local adverse events and 55–80% of systemic adverse events. Our results in transplanted patients were very similar, with 85% of local adverse events and 57% of patients showing systemic adverse events. The study from Japan that I mentioned before also found no differences between transplanted recipients and healthy volunteers. However, other studies have found somewhat different results. Some reported a higher incidence of adverse events, as was the case in the study from Israel that I previously mentioned, while other studies reported lower side effects. For instance, a study from Poland, whose patients, however, had been transplanted more than 3 years before vaccination, and so they were at lower risk of immune side effects. Of course, results from our recently transplanted patients should differ from those in the Polish study, but it's comforting that no relevant toxicities were found in either study. As in healthy adults, the most common adverse event in transplanted patients was pain at the site of injection. And the most common systemic effects were fatigue and headache, which were also the most frequent ones in the pivotal trial. That proves that our results in a high-risk population are a close replica of the original trial. Also, in the pivotal trial, the incidence of local adverse events was similar between the first and second dose, while the systemic ones increased a lot with the second dose. We reported the same results in transplant recipients applying the non-parametric Wilcoxon's test, which showed significant differences between the first and second dose of all systemic adverse events, except for headache and nausea, which didn't differ between doses. We also saw an incidence of 24% of fever after the second dose. However, grade 3 or higher adverse events were very uncommon, suggesting that mRNA vaccines are safe in transplanted patients. Although not published yet, we didn't see any serious adverse events after a third dose of the vaccine either. Interestingly, we also observed that female sex and prior COVID-19 were associated with a higher incidence of adverse events, as found in the general population studies. Thus, all in all, with today's available data, we can conclude that mRNA-based vaccines are safe in transplanted patients, and they should be given to them as soon as they recover from the immediate post-transplant period. Thank you for listening.